Welcome to the third issue of MID, which is brought to you by GC Europe. Hi, I'm Marita Kritzinger, and I'm the editor of this publication, and I'd like to share with you some highlights that you can read about. Has been dubbed the re-mineralisation issue, and for obvious reasons. First up, we bring you an article on MIH, or molar incisor hypomineralization, written by David Manton, who is head of paediatric dentistry at the University of Melbourne's Dental School. He talks about the challenges that face the general dental practitioner with the increasing prevalence of MIH, the lack of evidence, and the difficulty in treating it and also diagnosing this condition. We then have an article by Dr. Laurie Walsh, who looks at the conclusive and mounting evidence of the effectiveness of CPP-ACP, which is of course the active ingredient in tooth mousse, also known as MI paste in some regions of the world. Now, when you speak to any dentist who doesn't understand fully the concept of MID, they will always ask you, how does this make money? And because of that, we interviewed Dr. Kirk Young, who recently won Preventive Practice of the Year. And he talks about how he implements MID, why he's done it, and how it works financially. And to back this up, we also spoke to his practice manager, Sally Wright, and she talks about the operational aspects and how this is implemented through the entire business function of that dental practice. As always, we like to bring you clinical evidence and how that translates into daily practice for dentists. So we've worked with Stefan Mickenauch from the MI Compendium, and we've looked at a systematic review that looks at the caries effect, the caries preventive effect of CPP-ACP. And we've asked him some questions about what the systematic review means. We've untangled all the academic speak. And then we ask Dr. Andrew Brustek, who is a dentist in Perth, Australia, of how he uses this evidence and applies it to treatment and diagnosis of caries, etc. for his patients. And he shares with us a clinical case. I hope you enjoy reading this issue, and if you have any feedback or if you'd like to subscribe, please use the links below. Happy reading.